Good afternoon. Thank you, Max, and really happy to be here today with you all. I've just joined the governor in a conversation with childcare programs, large and small, in Connecticut, family childcare homes and centers about some of the challenges that they've been facing through COVID, now approaching 2 years. The governor from the beginning has been clear that he sees childcare providers as on the front lines and as critical infrastructure in responding to the pandemic. And they indeed have been on the front lines, caring for children, allowing families to go to work and providing that high quality early childhood education that helps children be ready for school. We really had a wonderful conversation, and we're joined by a couple of those providers for this press conference, but they are all on in case there are particular questions. It's been important to Governor Lamont that we support preschools and childcare in Connecticut, and we've been really fortunate to get the federal funding from CARES to coronavirus relief to the American Rescue Plan. Connecticut has worked to get these funds out to providers as quickly as possible. We've had great reciprocal conversations because we have a strong advocacy community, but also because providers are outspoken, really grateful for their voices. And in Connecticut, we have an Office of Early Childhood, which is totally focused on the needs of early childhood education. We were able to get those funds out quickly in Connecticut. And indeed, we have lost less than 1% of our licensed childcare capacity, family childcare and centers, because of those efforts, because of Governor Lamont's swift action in approving programs to provide stabilization dollars to programs. According to Bipartisan Policy Center, most states have lost at least 10% of their supply. So his swift action has made a really big difference. And I have to put it out there that providers' incredible hard work staying open at a time when they face workforce challenges, enrollment challenges, and all of the anxieties that come along with the pandemic and working with many children. It's been a real challenge that the providers have met. In Connecticut, we know that Build Back Better is a critical component of helping us maintain supply as the coronavirus relief funds run out. And we're committed to working to implement that if it passes, and the childcare part is super important to the governor and to us. So I'm going to ask our providers to just, characterize a conversation with the governor and talk about some of the challenges you're facing and some of the steps that we have taken to help, or something else that we could do to help. So I have two providers with me, Dr. Monette Ferguson and David Morgan. Both of them started as early childhood educators and made their way up to be CEOs of two of the largest community-based agencies in the state, serving, both of them, I believe, serve more than 1,000 children and families, and are really backbone agencies for their region. So they get the big picture about what families need, but they both are grounded in that high quality early childhood practice, and they know what providers are going through. So I'm going to start with David Morgan from Team and Waterbury, and then David, if you can turn it over to Monette, it'd be great to hear from you.
Thank you, Commissioner. Thank you, Governor. And again, as Commissioner said, when you look at childcare and you look at its many settings, from family childcare homes to childcare centers, the staff have been bearing and continue to bear increased significant health risks in the front line for, as we enter, it's hard to believe we're going to enter year 3 in about 60 days from now. And we had a very good, candid discussion with the governor around the realities of childcare, a system that pre-pandemic was extremely vulnerable in labor shortage and staffing capacity, and extremely vulnerable in funding models. And there's very little to grab from this very challenging COVID-19 experience that all of us are swimming through, affecting every part of our lives. But if there's one thing that we do, it did shine the light on, is how childcare is such a critical element to the economic vitality of the state of Connecticut, to any community and any neighborhood throughout the state of Connecticut. Unfortunately, All businesses and corporations from all walks of life, small and large, realized this immediately. The initial sign being hospitals and healthcare workers. You see 1 out of 3 workers in the state of Connecticut are parents. Childcare works so parents can work. And so as we continue to navigate and modify throughout this pandemic, kind of two buckets of thinking. Number one, a big thank you, but our second one is a tension point, and a thank you to the Governor Lamont. Thank you to all of the departments, especially the Connecticut Office of Early Childhood. A lot of us shudder to think where Connecticut would be without their leadership and without the mobilization creatively at the federal and state and local level to get those resources to the front line to not only respond to COVID-19, but to always try to keep our eye on the long-term recovery in the horizon. A lot of examples of the child care stabilization funding, keeping centers open that otherwise would have shut, keeping family child care centers open that otherwise would have shut, getting masks, cleaning supplies, increased, modified, improved learning environments. And, I've had a front row seat of this with childcare, and I would say that it was no surprise that Washington, D.C. asked Connecticut to speak about its use of childcare stabilization. They asked Connecticut before any other state in the country, and that is because of the ability of the money to get to the front line as quickly and as efficiently as possible, and it did. And so a big kudos to Connecticut and a thank you. Most recently would be the testing kits, which is there's good, bad, and ugly. Big, as I said to the governor and the commissioner, Tuesday, early last week, the distribution of testing kits to childcare providers in multiple settings. We were challenged by everybody needing testing kits from all sectors, not just childcare, school districts and beyond. And so we had some challenges accessing the testing kits, but make no mistake that we were able to utilize those testing kits in real time. And some of the examples, as I shared, and we heard in our discussion beforehand, a child in a child care setting being identified with positive COVID-19, 2 child care providers, family child care homes identifying positive, coming up positive. And so our ability to respond in real time and increase health precautions and protocols with the CDC and public health guidance, that would not have been possible if we did not get those testing kits early last week. So it's a thank you. And then of course the second round just last Saturday, where the governor and all the moving parts was able to mobilize regional distributions of testing kits. And before a conversation with the governor, actually just finished this morning getting those to a whole web of family childcare settings. And so big thank you, but we need more testing kits, and we need them more frequently. Again, children and families, and being able to give them to the parents of the kids with symptoms coming into the child care settings, trying to mitigate and reduce the impact to health and wellness, and of course to employability and jobs that is disrupting parents and businesses due to this current wave. Lastly, the second piece is the kind of the tension point that we are definitely at a labor shortage and a staffing crisis that is really needs significant federal investment. Again, childcare works so people can work, and this pandemic has shined the light on that. And having pursued this field since I walked out of the University of Connecticut, I don't say this lightly, but we right now have a funding model and a market that compromises fiscal solvency and sustainability of quality childcare. And because we are in that arena, even it was vulnerable pre-pandemic, is exceedingly vulnerable in the pandemic. It will continue post-pandemic if we don't figure out how to get this right, this arena of childcare, and it cannot go on the backs of parents and families. It has to be addressed in a very meaningful mixed delivery system that's going to require out-of-the-box thinking and funding, and again, federal investments as well. because otherwise we will continue to compromise. There will not be an economic recovery without childcare, and we will continue to compromise, learning, health, and safety for young children and families who really want the best for themselves and their loved ones. And I'm going to pass it over to Dr. Ferguson, who, like many other childcare programs, has never gone home, has continued to serve in the front line, providing childcare, as well as, childcare being such an element to gainful employment and workforce development. And so I'll pass it on to Monette, please.
Thank you, David, and thank you for your partnership. I want to thank the governor and also the commissioner for always having not just a listening ear, but also providing the resources for us to touch community members, already vulnerable community members that needed additional assistance while we were all experiencing the pandemic. David mentioned that we're entering year 3 of a situation that we thought would probably end overnight. And we see that the resources that not just us as large child care providers need, but also our brother and sister providers across the state also have a need for. I'd like to say at the height of the pandemic, though we continue to serve vulnerable populations, there was a lot of lessons to be learned. I think from the Office of Early Childhood, we learned that they can be a partner as well as a resource. We learned that they were a good listener, but also a good actor. So it's great to listen, but it's also great to get into action. And I think Connecticut was raised up as one of the fastest acting states to get the money out to providers like myself on the ground floor. We serve over 1,000 vulnerable families and children in the Bridgeport and Greater Fairfield County area. And it was important, not just the fear factor overtook us all, but it was important that our families knew that we were going to stand with them and we were going to stand together and we were going to get through this together. And I think Connecticut, as we say, it's small and mighty, and Connecticut is just big enough to be the perfect model to move forward with strengthening this system so that we can not only overcome this pandemic, but any other phases that are going to come our way. And we can't be prepared for everything, but we've learned so many lessons that help us prepare for the next step. One of the lessons that we've learned here at Alliance is that our families have voice, and we need to listen to them, and we need to do as they say they need to be done. So when we think about what we think is best for us, it is a better opportunity for us to learn when we listen to our families that need us most. In addition to that, the use of technology was stood up. We realized our weaknesses as well as our strengths. Our workforce development, again, shone a huge light on weaknesses as well as strengths. And also I'd like to uplift the partnerships that were strengthened and developed during a critical crisis in the entire world. If I didn't have partners like my community health centers, my community, my higher ed, my factories, my industry, all folks that wrap their arms around community action and early childhood, knowing that we could only stand stronger together. And these relationships will be strengthened over time, and they will help us into the future. None of us could do this alone. And Alliance, as a community action agency, we have several programs that help uplift families and help them lift out of poverty. But in a situation, in a crisis situation, there's always a big picture, and then there's the individual family that we have to wrap our arms around. And I can't say enough thank you to the leaders of this state and also the leaders at a local level, like myself and David, who every single day had to be the example to our staff and our families, as scary as these times are, is that we need to move forward, and we need to move forward in a way that is smart and safe, and that is possible, that there is hope and there is a possibility. So I thank you for this opportunity to talk and to share. I look forward to more opportunities to, again, we talked earlier with the governor about building our plane while we're flying it. And it has one wing on it, I think. I think we're putting the other wing on, and we got an engine, and we're getting there. And I appreciate this time. Thank you.
Thank you. Thank you, David and Monette, for your remarks and your availability for questions, because you know what's happening on the ground. And we heard from the WISE and from Family Child Care about some of the challenges, and Karen Lott from Women's League about some of the challenges that they're facing. So I'm really happy to be able to introduce the governor after the conversation and just thank him for his leadership and the cross-agency work that's been going on with the masks and tests. It was DEMIS, the National Guard, DAS, the Office of Early Childhood, the State Department of Ed, and Department of Environmental Protection, all working to make sure Saturday's regional distributions could happen. But that's been his approach as a leader, period, is the commissioners work together. I get tremendous support from my fellow commissioners. And I think that from the outset, Governor Lamont has had childcare as critical infrastructure in the response to this pandemic, and the resources have followed, and the direction to get the federal resources out on the ground and out to communities that needed it most. So Governor, I'm happy to introduce you for remarks, and then I believe there will be time for question and answer.
All right, well, Beth and Monette and David, right back at you. Look, it was about 20 months ago. If you didn't know how vital a quality daycare, childcare is, we learned right up front when we were getting hit by the worst of the pandemic and our hospitals are getting overwhelmed and we're desperate to get nurses and docs and staffs back into the hospital so we can take care of folks. One of the first calls I got from the hospital executives was, we need childcare. Otherwise, this nurse, this doc won't be able to come in because they need to be able to take care of somebody, quality way to take care of their kids. And, I reached out to Beth. This is before there were any federal programs. There was nothing out there. And we reached out to the private sector community. We got some incredible philanthropic donations, worked with 4CT, able to step up childcare right next to all of our key hospitals, just to make sure that moms and dads could take care of those folks most in need in the hospital, and they could rest assured that their kids were being well taken care of right nearby. So that was the early reminder of what we had to do going forward. And subsequent to that, as you've heard, the federal government did step up. We've got significant resources, hundreds of millions of dollars that, thanks to Beth, she put the money to work. We didn't husband it. We didn't sit in a bank account. We didn't wait for a rainy day. We put that money to work. In fact, the president and the vice president both came to Connecticut, just to salute how Beth and her team, working with our amazing daycare partners, were able to get that money to work. Monette, she really focuses on workforce. And we've got a new appreciation of a lot of people want to step up. A lot of people need the job skills. A lot of people got to get back into the game, and they can't get back to work unless they have quality daycare and childcare attached to what they've got to do. And she works with Housatonic, she works with Workforce, she works with all the teams, but told the story previously about how we'll never get our economy going again unless we make sure there's quality daycare, childcare for each and every one of those single parents, two earner parents, making sure that their kids are in a safe, nurturing environment so that they can get back to work. And David reminded us in no uncertain terms that, daycare and childcare is at a crossroads. And one of the biggest issues we have is staffing, and make sure we can continue to train and pay quality daycare staff so they're able to step up and fill the need, because this is not a need that's going to be strictly tied just to this pandemic. I think it's part of our economy and part of everything we got to do going forward, and part of giving kids the very best head start in life. And that's what this is about. And I've got to tell you that Beth has been, we got resources, we got, another year or so of resources in terms of being able to subsidize childcare to make it more affordable for, young families, being able to give a true up, a little bit of additional pay to make sure that our amazing providers are able to pay the people what they need to do. But if I look at what this Build Back Better is coming out of Washington, we've been hearing about it for like months, like forever at this point. If you ask me what is the most important piece of this that we've got to get past, it's the early child care, daycare, and universal pre-K. That's what I want to see passed. That's what I want to make sure that that gets out the door, over the next 30 days. What that means in terms of kids, what that means in terms of our providers, what that means in terms of our economy is just more important than ever. And that's why I wanted to do this event today. Back to you, Beth. Thanks, everybody.
Thanks, Governor. And just one last point for context. If Build Back Better were to pass, Connecticut would get an additional $168 million in the first year, and that would increase over time and would allow us to design and build a system that pays a fair wage, can attract the workforce that the governor talked about, and assure that families pay no more than 7% of their income on childcare. So the relief dollars have been incredible. We're grateful to the delegation for their hard work, but childcare, in order for these programs to sustain, we really need the next federal investment. So, but happy to take questions. The governor's happy to take questions. I'm happy to take questions, and we have providers on the line as well.
We'll take our first question from Sue Haig with the Associated Press.
Thank you, Max. I appreciate it. I was wondering from the providers, what's the current protocol for childcare workers if they test positive? And is that exacerbating the staffing issues because these people have to stay out? And is there any consideration of possibly allowing infected asymptomatic workers to perhaps return to work without isolating? And I don't know even if the governor's looking at this in terms of healthcare workers for that matter as well.
I don't know if Monette or David wants to speak to how you manage that. Yeah,
absolutely. So I'm just going to repeat something my peer said earlier, is that we work with one of the most vulnerable populations on the planet. We work with children 5 and under, and they cannot be vaccinated. Alliance have resorted to the 5-day isolation for positive staff. The tests that were provided by the state and by the feds have really helped us identify quickly a population of folks that need to step away for their own health concerns. And for us to keep a workforce going, we have to respect those protocols. Is it injuring? Of course it is. Does it bruise the workforce? Of course it does. But we cannot continue to help our families get back to work and get earning unless we respect these protocols. We have not considered asymptomatic folks to continue on because of the population we serve. Our babies and our infants and toddlers and our preschoolers are not eligible for the vaccine yet. So we really need to be as careful as possible with our most vulnerable population that we serve. I have to say science is amazing. CDC guidelines have shifted to help us continue to care and to provide care. But as science continues to evolve, we'll evolve with it, and we'll do the best we can to continue to serve the population. Thank you.
I would echo with Dr. Ferguson. Again, what has gotten childcare this far has been following the guidance of our state public health and the CDC. The recent updates to the quarantine, we have adopted here at TEAM the 5-day quarantine. However, that being said, we still maintain a 10-day quarantine for the children because of the inability for all young children to strictly abide by wearing a mask 100% of the time is not real. So that change from about 10 days ago, the updated CDC guidance has lessened the amount of time that childcare workers are out. And finally, I'd be remiss in saying when the pandemic is over, there will still be a childcare crisis because we have a funding problem with childcare.
And Sue, I would just direct you to the OEC working with Department of Public Health and the State Department of Ed have updated what's called Memo 37 on our website. For anyone that wants to look that up, you'll see the guidance that we send out to programs, and then programs work with local health because every case is somewhat individual, but that is available if you'd like to see that.
Great. And I wanted to ask a question on behalf of Christine Stewart. I think she had to jump off. She wanted me to ask, can someone ask about how many childcare slots we have lost? Is there currently a waiting list? And also, what are you hearing from parents? Are they scared to send their kids to childcare?
Governor, do you want me to take that one? So I'll take that one. And I think there are a few ways you can give this data out. As I said, because of the philanthropies donation, we were able to stand up 12 family childcare networks that we will continue to fund in perpetuity because we've seen the value of them in helping family childcares to both survive and also help license new family childcare homes, et cetera. But the number I have is how many, I knew this question was coming in, how do we best compare it over time? And what we're seeing in Connecticut, if I look at the number of licensed centers and how many have, turned in their licenses, we have right now 1,385 licensed centers and 1,886 licensed family childcare homes. And in 2020, at the beginning of the pandemic, we had 1,410 centers and 1,888 family childcare homes. So we have lost some centers, but the federal dollars have really helped us hold on to supply. I have a graph that shows how much we were anticipated to lose as a state and how much we actually lost. And in fact, it's less than 1%. And I think I said before, I reached out to Bipartisan Policy Center that estimates that most states have lost about 10%. And we really believe the Connecticut innovation of family childcare networks and the quick release of the funds has helped programs hold on for now. Those funds will start to run out in the near future. So that's why Build Back Better becomes so important. So that was your first question.
Is there a waiting list, and are you hearing from parents who may be scared to send their kids?
Different families have different comfort levels, so I can't answer for the whole state. But Sue, there tends to be, it differs depending on where in the state people are. Some programs have waiting lists. Some programs have empty classrooms, waiting lists, but they can't hire the staff. We heard from Karen Lott about that. We heard from John Benigni about that there are classrooms closed because there isn't enough workforce, even if the programs are open. So that's a big challenge. So they're waiting, but there are other programs, particularly in our larger cities, that have much lower enrollments than they had. And so we're trying to figure out, what's going on there. And I don't know if I'll ask Max for guidance if you want me to show the slide that shows what's happened with childcare capacity, or I can share. Oh, I can't share that. I could share a slide that sort of shows what were the projections and where we are, but I think you get from my numbers that we have a very similar amount of centers, slight reduction, but less than just about 1% reduction in overall number of licenses.
Great, thank you very much.
We'll go next to Ken Dixon, Hearst, Connecticut Media.
Thanks, Max. Governor, it seems like is there any wiggle room for the state to help with the labor shortage, like provide bonus pay, possibly lower some kind of certification standard for early childhood workers? What are you contemplating along those lines?
Look, that's a really good question. Right now, we made sure that the additional resources that went to the child care providers, 25% of that did go to additional pay. I think Monette will say all the efforts we're making to train more daycare providers out there, ways that we can subsidize tuition to make that easier for folks to get into the profession. And we'll see what else we got to do from there.
One other added thing, Governor, that I'll add is that in January for state-funded childcare programs, we are piloting a qualified workforce bonus for people that have the, depending on the educational level, will get an additional bonus. Every worker will get some bonus, but the higher the degree, the larger bonus, because that's who we're losing, and mostly many times to public schools. And then after that happens, we've set aside some of the federal stimulus dollars to have that go to all programs. But we first want to pilot it and then work on that, because that is a critical shortage. The workforce is the biggest issue going on right now for the field, for sure.
And Governor, do you have early numbers today on weekend hospitalizations and positivity tests?
We haven't seen those yet, have we? We'll get those out to you soon. I haven't seen them yet, Ken.
Thanks. And finally, Governor, how is the smart card sign up going? Would you consider a New York style proof of vaccination requirement for indoor dining? You said you feel more comfortable when the restaurants require proof.
I can tell you that hundreds of thousands of folks have downloaded the digital health card, making it a lot easier for them to be able to demonstrate that their vaccination status coming into a restaurant or bar, like Bar down in New Haven requires it. I'd like to see more restaurants and bars and stores, send notice that we'd like to see your vaccination stats. So I think we're making progress on that. I'd like to see more.
Thank you.
Go next to Paul Hughes of Waterbury Republican American.
Thanks. Just got a question for David Morgan. What can you give us some examples of some of the out-of-the-box thinking and out-of-the-box funding that you think is needed here?
Well, like we heard earlier, I think number one, you need a significant investment at the federal level. And there's a lot of details in a framework. We heard it from the commissioner, we heard it from the governor in the Build Better Act. So it's beyond the capacity, in my humble opinion, it's beyond the capacity of the Connecticut Office of Early Childhood and the state of Connecticut. We need federal investment in childcare. And unfortunately, what's happening right now is a lot of this is falling on the backs of hardworking parents and families. And often when you heard about workforce before, I call it a catch-22. Mom, dad, or primary caregiver, they can't get to work because they can't find the childcare. When they find the childcare, they can't afford the childcare because they don't have the gainful employment yet. And so that's the catch-22. When you're looking at average, childcare rates in the $200 range per week, over $300 range per week in infant toddler capacity, it creates a real challenge for families. And so part of our broken solution right now is we're putting too much on the backs of families. And the most devastating reality is childcare workers, early childhood professionals pouring themselves into this work, and they are getting paid far lower than many other fields that require less credentials, knowledge, skills, and abilities. And that's a tragedy. And the last thing I would say is that, in July 2021, just a few months ago, the National Association for the Education of Young Children did a survey of early childhood professionals and providers from mixed settings, from licensed family childcare homes to center-based, community-based childcare centers. 1 out of every 3 survey respondents said they are going to either close or leave the field in the next 12 months. And the follow-up answer to their survey was 71% of those, they're going to, and yet we heard it from Commissioner Bai, they're going to jump into the public school arena, whether it's working as a para, food service staff, teacher's aide, school bus, et cetera. And so that's why Connecticut, when we think about long-term recovery, you do not have long-term economic recovery without childcare, as the governor said.
And what have you seen in terms of enrollment in your early childhood and Head Start operations, particularly in Naugatuck and Waterbury?
So pre-pandemic, we were maxed with a significant waiting list, especially infant toddler capacity, birth to age 3. Not a day or a week would go by where a working parent or family would be calling teams saying, I need childcare. I'm trying to get back, trying to get sustainable care so I can go to school or go to work. That is very much the case in all the communities in Connecticut, especially infant toddler care capacity. In the pandemic, that's a really hard question to answer, as Commissioner touched on. Between the labor shortages, the quarantine periods, the isolations, the business sector from remote job capacity, shutting down, going back in, the whole spectrum is covered. the fears and anxieties of workforce reentry and going back out there, so to speak. So it's a really mixed soup. And because of the labor shortage, you know, providers having to close classrooms due to lack of staffing. We've got a whole mixed bag of families who are not ready and they're able to make personal choices and not absolutely need the childcare due to the pandemic environment. At the same time, there's families saying, oh my goodness, the sky is falling, and they're right to feel that way because now we shut down a classroom or shut down a childcare program due to COVID-19 protocols. So we have, my long-winded answer is we kind of have a wait list, but sometimes we don't. But all those roads lead to the, you know, the confusion of COVID-19 impact.
Okay. And before the president visited the state, the lieutenant governor threw out a figure of the state lost 50,000 childcare spots as a result of the pandemic. Do we have any updated number now?
Yeah, Paul, the number she was quoting was a projection from the Center for American Progress. And we were anticipated to lose that many spaces. That was the projection. And we did not lose that many spaces. As I said, we've been able to hold on to most of our supply. That said, at the height of the pandemic, 75% of centers and 30% of family childcare homes were closed. So that certainly would be more than 40,000 without childcare. But the vast majority have come back online, or if some closed, others opened, and we are back within 1% of our pre-pandemic number of childcare programs.
And what about staffing positions?
Well, that's the challenge. The programs are open, but as you heard David say, try to answer your question there, he may have a waiting list and he also may have classrooms that are closed. To give you a sense of our state-funded programs, so that's about a quarter of the supply for the state. There were about 35 classrooms closed because of workforce, not having enough workforce in those 35 classrooms. So that's not, it's not where we want to be, but that's 25% of the whole supply. There are about 35 classrooms closed. So that is our focus at the Office of Early Childhood right now, is how do we get the workforce? How do we help programs make sure they can pay the workforce at a level that is competing when there's so many low-wage jobs have brought the wages up. Childcare continues with some of those constraints that David talked about and Monette talked about on the budget.
Okay, thanks very much.
Go next to Seamus McAvoy, Hartford Courant.
Good afternoon, and thank you all for being here. I've got a couple questions for the governor, but I want to start with David and possibly Monette as well with this first question. By some coincidence, I was actually speaking with some childcare providers last week. I know Commissioner Bai and I had a conversation, I think it was Thursday evening, and they were basically saying all the same things. I mean, really sounding the alarm here about Connecticut's early childcare industry, which, you know, as has been said here, was in rough shape even before the pandemic. Be it wages that haven't changed in years, the difficulty recruiting new staff. I mean, there's this picture of the whole industry in Connecticut as being in crisis, both before, during, and likely after the pandemic as well, as David, you've noted. I guess one thing that hasn't been touched on is, I mean, how did this happen? I mean, how did we allow the funding model for childcare in this state to get into what sounds to be like such a mess? And to what degree is that unique in Connecticut or worse in this state than others?
Commissioner, do you want to?
Sure. I mean, I'm happy to reply to that. I think Connecticut actually, from my time during the pandemic, we meet regularly with other commissioners. Connecticut's actually in better shape than most states with the state investments in school readiness and early Head Start. The legislature and the governor now, and governors since the mid-90s, have put significant state appropriations. Some states rely solely on federal funding. But early childhood, I know I got involved because I had so much turnover in the workforce in the mid-80s. And that problem persists and is even worse now than it was then, I would say, because there's a mismatch between what parents can afford and what it costs to run a program. Unlike schools, there was no stable federal and state funding for childcare. There's been some for families at the lowest end of the income spectrum, but middle-class families really struggle to afford high-quality early childhood education. And since the late 90s, Connecticut has made significant state investments coupled with federal investments. But I think that's why you see a bill as large as Build Back Better and a program as big as $400 billion, which is proposed for childcare, have a lot of support across both parties. The childcare part of that bill is perhaps the most popular because I think there's a recognition now that the bottom has dropped off. And, you know, David, you can feel free to follow up too, but I do think this has been going on for decades and it's a reckoning now with COVID.
Yeah, well stated, Commissioner. This is not a mess we fell into. This is something that has been ignored for too long. I won't geek out and go into 50 years of history, but literally, to the Commissioner's point, multiple decades of something that has not received its due attention. And I would say to you, coming out of the University of Connecticut with a degree in early childhood and being a certified, pre-K to sixth grade educator, we have rightly so shined the light on public schools and public education, K to 12 and outcomes and return on investments. We have not done the same historically in early childhood. And I'll gently say, we just didn't know what we didn't know, but the science and the research is very clear around early experiences matter. We know around what the brain science tells us from birth to age 3. More rapid development than any other time throughout the remainder of the human experience from age 4 all the way to our last day here. And we know that between ages 3 to 5, finishing preschool, that the brain has developed to 90% of capacity. So there's a real science argument on this, and there's a real understanding that you get one chance to get it right for young children, to surround them with rich early experiences. And mental health starts in early childhood as well by that. So I would add that, and there's a lot of studies and a lot of, from Nobel laureate economists, from Heckman to, the Harvard School for on the Development Child. So just from the educational aspect, we have been screaming this as a field, and I know the commissioner has, and from multiple hats that she has worn over the years. The governor gets it. You heard from an economic standpoint. And the last thing I'll say is when we were looking at, reopening Connecticut in May 19th, I believe, 2021, and having served myself and other childcare colleagues serving on the COVID-19 response and recovery groups for all the different regions, and serving on Region 5 covering Waterbury and the Lower Naugatuck Valley, a very common theme coming out of that reentry was when they were looking at existing current needs and response and how do we get our eye on the horizon. Everyone's back except for the most part. What we're hearing from the corporations and businesses is just the ones with children. They're still not back because they can't find childcare. So I would say to you, that's one anecdote of a monumental tsunami of a problem, even when this pandemic is over, on how we have a real strong, vibrant economy for hardworking people who want the best for themselves, for their loved ones, and for the communities they want to live and work in.
And I'd like to add how did we get here? I'd like to add to that. I think part of the reason how we got here is on the backs of resilient providers. A provider like myself who serves thousands of families over the years, and I've been doing this for a really long time and proud to say we'll continue to do this because of the uplifting it provides for my community, not just in Bridgeport, but across the state. But I'd like to say that we don't turn families away. We don't say no. We don't say we can't. We try to provide a way to make it happen because families rely on us so they can get back to doing what they do best, to provide for their family. So we're part of that chain, that mechanism that holds families together. And we can never deny the fact that we're part of that big picture of that glue that holds our whole community together. So as well as, yes, economy, I agree with David and Beth and everything they've said, but providers have taken an L for decades. And the L was well fought, trust me, because it helped families get on their feet. It helped children like myself when I was of age for my mom to stay in the workforce. But it is time that we evolve into a better structure that does not create deficits for providers.
Thank you all so much. I don't know that it was kind of a big question, right? With 50 years of history. So I really do appreciate that context and that background there. And I was wondering, I mean, the providers I was speaking with, I mean, they did applaud the state for doing such a good job for getting that. I think it was about 120 million out. I mean, there's like half the states in the country haven't gotten any of that money out yet, right? And it's like, you wonder how there's even a childcare industry in some of these other states. So I think that's very, very important to note. With that being said, you know, we've had multiple references here to Build Back Better. And I mean, I personally can't read the congressional tea leaves, but, you know, the future of that is still up in the air, I think. And even if it does come through, it may come at the cost of reduced child tax credits to appease the senator from West Virginia, which isn't exactly great news for working families either. While we wait for that, I mean, there's a serious danger here within the next 12 months. I believe, David, that's what you referred to with a third of those survey respondents. I know that the size of this problem is something that maybe only the federal purse strings can address adequately. But in the meantime, are there further state investments that could be on the horizon in the short term to just try to keep folks afloat, you know, and keep that fight alive?
I can start with that, Seamus. As you heard Beth say, many states don't provide any state participation. They just rely upon the erratic money that comes from the feds when they're in the mood. That's not Connecticut. I think we do a couple $100 million on top of what we get from the feds. The Fed allow us to enhance, expand, and subsidize. I will just repeat, I think when it comes to Build Back Better, the child care piece is the most important, what it means for the kids, what it means for our economy.
We'll move along next to John Craven with News 12 Connecticut.
Hey everybody. So just how bad is the staffing shortage right now? And how much of that is due to COVID and how much of that is due to just existing staff shortages?
I have some anecdotal data, and I'll let Monette and David chime in if they'd like, but we made some calls last week to our state-funded programs, and it felt like about 15% of them were experiencing at least one classroom closed, either due to COVID or workforce shortage. I think when David tried to answer that question, you can hear how these two things are overlapping. And then it impacts enrollment, because if parents can't count on a program being open, they may then ultimately pull the child for another option, which then hurts enrollment, which then hurts income. And so I know the YMs in the program, in the conversation with the governor, we're talking about, you know, the need for stabilization because of that workforce in and out. If a program keeps opening and closing, you have part-time staff that are paid hourly. So it's almost impossible to pull those two things apart, but I'll let Monette or David add on if they have anything.
Yeah, I mean, I agree, and I'm sure David will agree. There's an ebb and flow to these situations. We're also, my major concern week after week is losing folks to other entities for pay. We can only get so far, and when folks are making $3 and $4 more than what we're able to offer, so that conversation is dead in the water, you know. So for us here at Alliance, we are operating 100% of 15 of our sites. Classrooms do open and close due to exposure, as well as folks resigning. I would say probably about 92% are open and operating, but that could change tomorrow. And we keep an eye on it. And we're constantly looking for innovative ways to attract folks to the workforce. But there's no simple, easy solution. But we thrive to keep creating solutions, as you know, with COVID and the easy transmittability. We can't keep moving staff around. We don't divide cohorts. We don't move staff around from building to building for ratio issues. So we're forced to close. So there's a definite ebb and flow to it. and we just try to we absolutely abide by Connecticut guidelines and the restrictions around ratios, just to make sure children are safe.
So Monette, you know, a lot of parents are going to be watching this, and a lot of them are awfully scared to send their kids back to daycare. Talk directly to them, convince them that this is safe.
So first of all, I'd like to say, I understand, I'm scared as well. But as I said earlier with the governor, as science evolves itself, we are hopeful that there will be a vaccine for 5 and under soon. But for right now, we really rely on the safety CDC guidelines that our staff are so committed to and so up to date with, day after day, week after week, with all the changes. All our centers are cleaned and scoured and sanitized regularly. All our staff are vaccinated. Our new staff are vaccinated, and those who are on the fence are testing weekly. And we have committed to a safe environment for you and your children. And I'm speaking for all my peers that really, really have put blood, sweat, and tears and energy into creating a safe environment of quality, early learning safe environment during this pandemic. Restaurants cannot guarantee the safety that most of us can guarantee in our childcare sites because of the dedication of our staff. PPE, when it was not easy to come by, the state of Connecticut stood by our side and made sure that we had that available, not just to our staff, but also to our families. It is not an easy decision to make. I would say that the first thing you should do is tour your facility, call a provider, ask questions. Ask questions. Ask what happens if someone's exposed? What happens if my child has symptoms? What happens if the teacher has symptoms? So at least an educated mind is a prepared mind, and folks can make decisions based on the information that they have.
Yeah. And John, I just want to add one thing for families to consider as well, which is, you know, we talk a lot about the workforce and how important it is for the economy, but early childhood education is super important for young children's brains and spirits and minds and building executive function. And so, you know, when we saw the impact of kids who were pulled out of programs for a long period of time, whether they've gone to kindergarten or in early childhood settings, that structure and routine of high quality early childhood education is important for building young brains. And I know families are balancing a lot of things, and they are welcome to make the choices they make, but our providers are working super hard to keep it safe. And at OEC and with the governor's support, we're working to make the tools available to keep programs safe.
And Governor, just one quick off-topic question for you. Getting some very, very cold weather tonight. You've activated the severe weather protocol. Can you just sort of talk about what options are available to people through the state, through their local providers?
Yeah, thank you, John. Extremely cold weather. We've got the cold weather protocol in place. I think it's through Wednesday for another couple of days. You can go to 211.com, call 211. You can find out where you've got a warming shelter if that's necessary. I'd just urge you to call up, you know, maybe some seniors, some single folks living by themselves. Just make sure they're okay during this time. But I think it's a good time to stay close to home and stay warm. And we've got a warming shelter there available for you in your region. If you need it, go to 211.
Is there any concern about a shortage of homeless shelter space since they're not operating at full capacity right now?
My understanding is we do have space right now, so I think we'll be okay on that front.
And the final question we have time for will go from Jody Latina, News 8.
Good afternoon. Asking on behalf of one of my coworkers who's working on this story, if a family does not have access to their daycare because they have shut down, what are their rights as far as credit and recouping any of that money? And then a follow to that, would lack of daycare fall into a paid family medical leave requirement? Could they tap into that?
I don't know about the paid family medical leave issue, but we have been fielding a lot of questions like this from parents at OEC. And what people need to understand is childcare centers are, for the most part, small businesses, and they each have policies and procedures in place that they will enforce with families. If a program closes for for 5 days, say a classroom closes for 5 days and the parents don't have access to that childcare, most programs continue to charge tuition. It's a monthly tuition because they have to pay the staff. They're still paying rent. And as long as they want to maintain that spot, that's generally how the business operates and how they set up their policies. It's like if there was a 3-day snowstorm and the program closed, the parents generally still pay. Now, each program, other programs may have different policies in that. I'm just telling you what the average program has. And this is particularly challenging because we've never had a COVID situation, and programs didn't anticipate a pandemic when they wrote their policies, and families are under stress to provide childcare and may not be able to pay someone else to do childcare while they're paying the organization. So I think it's a good question on the paid leave. I don't know, Governor Lamont, if you know, or we could refer you to Andrea Barton-Reeves, who may know.
I'd go to Andrea. We've been doing this for 10 days now, Jody, but my instinct is paid family and medical is for medical anticipated surgeries and emergencies. I'm not sure this falls into that category, but check with her.
Okay. And I also did have a follow-up. Dennis House interviewed Mayor Florsheim this past weekend, and he was asking for a mask mandate and wondered if you were leaning toward that statewide, Governor.
I'm not. I do notice that, Jody, all of our densest communities have put in place a mask mandate. As you know, it's those communities are the ones that are responsible for enforcing something like this. So I think you'll find that right now we have the ability to keep ourselves safe. If I go into a store, I can get vaccinated, I can get boosted, I've got access to an N95 mask. So this is a very different situation than we were in a year and a half ago, where if somebody infected walked into a store, they would infect everybody else or could infect everybody else. And I was defenseless. At that point, the mask mandate made a lot of intellectual sense to keep you safe, not just that person. We're in a different situation today, and I think that's reflected in our policies.
And final question, this one's actually for me. It is campaign season, and I don't know if you had an opportunity to see it, but there was a digital ad released by the Republican State Party today that does not put you in a good light. And I wondered if you had a response.
Laney mentioned that to me. Jody, I think we're still in a war. We're in a war against an invisible enemy, COVID. And usually a state and a country when in a war, they rally together and they speak with one voice. And we don't take cheap political shots for political advantage, not when we're trying to get everybody through a tense situation. You know, we spent the last hour plus here, what we're doing in terms of daycare and childcare, getting them back on their feet on the ground, what that means in terms of getting our economy going. Just had the question about masks. If you have a constructive dispute, you know, give me a constructive alternative. Let's talk about it. You know, maybe you think I'm trying to keep schools open. You think they ought to shut down or something like that. But I think that make cheap political hay out of a tough situation is probably not in the best interest of the state right now.
Appreciate the time.
Thanks, Jody.
Thank you very much, everyone.
Max is still there, but thank you very much, everybody.
Thanks, everyone.
Annette,
Thank you.
David,
Thank you.
Beth.
Thank you.